The Associated Press recently reported that the week after the World Health Organization announced that the continent of Africa was free of the wild polio virus, a new polio outbreak in the country of Sudan is linked to an ongoing vaccine-spark epidemic in the African country of Chad. 2 days later, the head of the World Health Organization said he would not recommend any COVID-19 vaccine before it is proven safe and effective. We'll look at these claims that will soon hit very close to home in this episode of Analysis Behind the News, where we provide the perspective that you can use to restore American liberty and independence. On September 13, 2005, the Bill and Melinda Gates Foundation published an online press release announcing an emergency immunization plan to inoculate 34 million children in 8 countries in the Horn of Africa, including Sudan. Children were given multiple doses of polio vaccine to rapidly boost population immunity. Yet, this reactionary plan was based on one case of polio occurring in Somalia that had been declared polio-free for nearly 3 years. In July 2019, ScienceMag.org published "The Global Initiative to Eradicate Polio is Badly Stuck, Battling the Virus on 2 Fronts." New figures show the wild polio virus remains entrenched in Afghanistan and in Pakistan, its other holdout, where cases are surging. In Africa, meanwhile, the vaccine itself is spawning virulent strains. These 2 countries have relied on the WHO program, which, according to ScienceMag.org, has spent $16 billion over 30 years and had planned to eradicate polio from Pakistan and Afghanistan this year, only the latest of many deadlines. Instead, almost 4 times as many cases have occurred there so far this year than in the same period in 2018. At 51, the total number of cases may still seem low, but only about 1 in every 200 people infected with the virus develops paralysis, meaning thousands have been infected. Then, in November of that year, the AP reported that there were more polio cases now caused by vaccine than by wild virus in 4 African countries. 10 months later, last week's announcement by the UN says the polio outbreak in Sudan was caused by oral vaccine. The news report stated, in rare instances, the live polio virus in the oral vaccine can mutate into a form capable of sparking new outbreaks. Can you see where questions might arise regarding a COVID-19 vaccine for today? From the same ScienceMag.org article of 2019, it noted, in Africa, the vaccine-derived viruses circulating there are just as dangerous as the wild virus. These strains arise when the weakened live virus used in the oral polio vaccine mutates and regains its virulence. In rare instances, where a population's immunity is low, they can spread just like the wild virus. Last year, vaccine-derived viruses paralyzed 105 children worldwide, the wild virus just 33. To prevent outbreaks of vaccine-derived virus, WHO has declared that once the wild virus is gone, countries must stop all use of oral polio vaccine. When the cure is worse than the disease, shouldn't that warrant stopping it immediately? Incidentally, the other part of this story of why rates are skyrocketing in Afghanistan and Pakistan is that the government of Pakistan has been jailing non-compliant parents for several years. And some parents are so concerned about the vaccine that police have had to escort those vaccinating children, as some cases of murder have been reported. Even the Taliban has outlawed this vaccine. As an aside, this oral vaccine is not what is used in Western countries. The US and other Western countries use a more expensive injectable polio vaccine that contains an inactivated virus incapable of causing polio, according to AP. This means that poorer countries in Africa and Asia get the cheap-to-manufacture, less effective, and more troublesome oral drops. According to childrenshealthdefense.org, a newer foundation created by activist Robert F. Kennedy Jr., there were 400 recorded cases of vaccine-derived polio in more than 20 countries worldwide just within the last year. It also stated the Gates Foundation is a leading funder of oral polio vaccination in Africa and around the world, having dedicated nearly $4 billion to such efforts by the end of 2018. As discussed in Forbes in May 2019, Gates has personally driven the new development of new oral polio vaccines and plays a strategic role beyond funding. In a parallel to that, Mr. Gates has not been shy about calling for COVID-19 vaccines, insisting that the world will only be able to get back to normal once everyone is vaccinated. As Mr. Kennedy wrote on the site, anyone defending the Bill Gates/WHO global vaccine program needs to explain this study. Mogensen et al. 2017. Prior to 2017, neither U.S. Department of Health and Human Services nor WHO ever performed the kind of vaccinated/unvaccinated or placebo study necessary to ascertain if the DTP vaccine actually yields beneficial health outcomes. The DTP vaccine was discontinued in the U.S. and Western nations in the 1990s following thousands of reports of death and brain damage. Girls vaccinated with the DTP vaccine, the flagship of Bill Gates's Gavi/WHO African vaccine program, died at 10 times the rate of unvaccinated kids. Children's Health Defense labels this the Bill Gates effect. So the question must be asked, how will Americans be affected by the Bill Gates effect, knowing that he is funding and promoting a COVID-19 vaccine? On the Bill and Melinda Gates Foundation website, in the frequently asked questions section for COVID-19, the question is asked if a COVID-19 vaccine should be mandatory, and the response is rather chilling. It states, that decision is best made by individual governments. No mention of you and your doctor making this decision. Rather, it's left up to your government. How much do you trust your government? And the answer to the FAQ question continues with, vaccines are a powerful tool to fight disease and save lives. Over the past few decades, vaccines have been responsible for the eradication of smallpox and saving people from getting diseases like polio, meningitis, and measles. In some cases, the rate of disease spread has been reduced by more than 90%. No mention of the adverse effects of killing thousands of people or reigniting diseases that were once deemed eradicated. Finally, the FAQ answer concludes, safe and effective vaccines will end this crisis sooner. Our aim is to speed up research and development for COVID-19 vaccines and make them accessible and affordable for as many people as possible. The stance of the John Birch Society is not pro-vaccine, and it's not anti-vaccine either. As the organization has made mention over the decades, healthcare should be between you and your doctor, with no meddling, no intervening, or any say whatsoever from your government. A great tool to help create concerns about the COVID-19 vaccination is our reprint from the New American magazine called Forced Vaccines and Digital IDs. Hand these out and ask others to do the same. Then contact your state legislators and governor and tell them to say no to forced vaccinations. We've made it easy to do so at our COVID-19 action page. Links are in the video description. Who do you know that cares about freedom and independence? It's time to get them to act. I'm Bill Hahn for the John Birch Society, and until next time, stay informed, stay active, and stay safe, Patriots.